Tulsi Gabbard just thanked the who, the what, and not once but twice, the pathologists. Now I know why this lady was director of national intelligence, because she knows what's going on. But unfortunately, her husband has a sacral chordoma. Let me tell you what that is. We've got to go back to when you were swimming around in your mother's womb, kind of like a tadpole like this. You had a structure towards your back called the notochord. The notochord mostly disappears as you grow, although some of it does remain in your spinal cord as a cushion type of material. If any of the notochord cells remain outside of the spinal cord, they can very rarely turn into cancer like this. They can be on the sacrum or anywhere along the spine. We call the cancer a chordoma. The name denotes that it originated from the cells of the notochord. Get it? Here's what it looks like under the microscope. But now the important part. The margin status. That's how we decide if the surgeon was able to cut all the way around the tumor and get everything out of the body. And guess who does that? The pathologists. We put all that information in the pathology report, and sometimes we even do it while the patient is in the operating room. Margins are one of the most important factors we take into consideration for the prognosis of people with chordomas. I've talked about margins a lot, and they're important for all kinds of cancers, but especially for chordomas because they like to come back again and again. And thank God, Tulsi said that her husband's margins were completely negative, which means that the surgeon was able to successfully get all the tumor cells out of the body. I'm really rooting for Tulsi, her husband Abraham, and their whole family as they navigate this journey. I pray that God gives them comfort on the hard days that will inevitably come and blessings on the easy days. I'm Dr. Sarah Jelliff, a board-certified pathologist, and if you have any questions about your pathology report, let me know and we'll work through it together.